Hi everybody, it's Pam from Fit Mums and Bumps and Flaunted Fitness UK here. I'm just doing a little video for my Fit for Delivery girls, and what we are covering is yoga and exercises for pelvic girdle pain and symphysis pubis disorder. Movements that we want to avoid through the day, other movements that we can do instead, which are going to help to manage any pain or discomfort that you do have. I do recommend to see a women's health physio if you are suffering from any pain, and getting some hands-on sort of soft tissue therapy can really help to release off any muscles that are kind of tightened and that might be causing some pain. One of the first things I want to talk about is how you are feeling throughout your pregnancy. Are you feeling a little bit stressed or overwhelmed or maybe anxious for many reasons? If you are feeling any of those kind of symptoms, it could be that you have this kind of feeling, and it could be contributing to some of the pain. So trying to think of some relaxation methods, some nice breathing, some maybe mindfulness, some meditation, something like that that's going to help to relax you, get you a wee bit less anxious, taking some time out for yourself, as opposed to working right up to the end of maternity leave, and in that time you're getting everything ready for the baby, everything's really busy all the time. You really need to take a wee bit of downtime and looking after yourself. So if you are feeling this pain, it could be coming a little bit from if you're feeling quite stressed out and anxious and overwhelmed. So just take trying each day include a little bit of breathing, meditation, mindfulness, just something for yourself. If it's something simple like just going out for a walk, something like just taking a bath, anything that just gives you that little bit of time just to kind of try and empty your mind, and rather than thinking, oh, I need to do this, just take the time to think about the moment, and just do that, because that might help to reduce the pain a little bit as well. So specifically, what type of movements are we doing that can make your pelvic girdle pain or your symphysis pubis pain even worse, kind of thing? So anything that involves you taking your feet outwards and your knees out wide, toes turned out, is going to maybe add a wee bit more sort of movement and pressure in here. So instead of doing that, if you're having to take your feet wide, say for example in a squat position, getting up and down off a chair, getting up and down off the toilet, getting out of the car, think about keeping the toes pointing forwards as opposed to turning outwards. So this should make a little bit of a difference when you're kind of standing up and sitting down. So if you're standing up and sitting down with the feet out wide, try to maybe just bring them in a little bit closer, and think about pressing into the heels and exhaling as you come up to help activate the gluteal muscles, getting them nice and strong, okay? So avoid anything where you take your feet out nice and wide. The other thing you want to try and avoid is this, and then transferring your weight over. So for example, I'm in my car, I'm driving home from work, blah, 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 blah. I take my leg out and then I come up like that, yeah? This puts a huge amount of pressure on the pelvis. So instead of that, trying to bring one foot round, and then it's quite difficult to do this on a ball actually, and then bring the other foot round, keep your feet about hip distance or wider, press down into the heels, and exhale as you come up. That's going to help minimise the amount of pain, discomfort throughout the hips, the pelvis, and transferring that weight onto one leg, trying to minimise that as much as you can, okay? Deep stretches, so things like your any of your kind of deep squats here might be best avoided, again because of that position here. Anything like if you're doing any sort of yoga where your soles of your feet are together, your knees are out to the side, again this can cause a little bit more friction and kind of discomfort in the pubic area. So maybe doing something different instead. Your yoga teacher should be fine with you doing an alternative move. and yeah, that'll limit the discomfort. One of the other ones would be like a warrior 2 position, because you're opening out the pelvis. So maybe staying in a warrior 1 where your hips and your toes are all pointing forwards. And just again, being careful when you're transferring the weight, try to lean and just kind of bunny hop that foot in, as opposed to taking a big step forwards. Yeah, so kind of bringing this foot in nice and slowly will help. Any sort of out to the side and dragging in. I know sometimes we do in my Fit for Delivery class, we use the gliders. If this is causing any discomfort in there, you could go with a tap instead of the drag, as long as the tap isn't causing any pain. We want to avoid any single leg exercises, so things like your single leg squats. That's the same as transferring your weight onto one leg. So when you're standing up, making sure both feet are on the floor, and making sure that you're activating through the glutes as well, which means that you're pressing your heels down. The femur, so anything where you're doing this to the thigh bone, you're rotating outwards, is going to maybe aggravate a little bit as well. So we want to focus on lots of stretches throughout for the lower back. I've done a lot of I've done a release video in pregnancy using the gym ball, which has a lot of back exercises in it, and other videos will show you that as well. So making sure you get stretches through that lower back area, also through the glute area as well, which some of the positions that you need to be in to stretch off the glutes effectively can be a little bit more awkward in pregnancy, just because of bump being there. But trying to make sure you're getting those stretches through the glutes. Something just as simple as sitting with your feet crossed and leaning forwards like so. Whether you're leaning forwards there, you've got your hands on top of your gym ball here and leaning forwards. Yeah, that's going to help to stretch off into the glutes. You can do a seated stretch as well. Just make sure you're feeling supported. You can do this on a chair if you want, instead of here. So you've got your leg across and you're just pressing that knee down towards the floor. You can do this one at your desk. If you're at work, just try to make sure that you're not going too deep into the move when you're not thoroughly warm. So maybe doing it after you've been walked up the stairs or whatever, just to get the hips nice and moving. And then you're just adding a wee bit of pressure, so you're just pressing the knee outwards to stretch out the glute area and that piriformis muscle. Focusing, like I said at the start, on the breathing and getting some relaxation, because that's what's going to help to calm down the nervous system. So activating those happier relaxation hormones like the GABA receptors in the brain. We want to do that to try to reduce anxiety, reduce that feeling of overwhelmness, that sort of just keep going till you fall down, basically, isn't a good way to go through pregnancy. So trying to just take that time out. Your wall sit, I don't have it with me. So the wall sit position, which I'll show you here, although I was wanting you to show you with the mini band. So you know the little mini band, it's like a little loop. You would bring that over and you would place it on and above the knees, so it goes round the outside of your thighs. And as you come down into your wall sit position, you would take the feet quite wide and push the knees out so that you get that activation into the outside of the glutes. And you would do your wall sit position there. And this would be a good position to focus on your breath in, filling up the tummy, and then exhale, trying to draw the pelvic floor upwards and draw that transverse abdominis in as well. So focus on breathing in towards baby, and then exhale. And while you're doing that, you've got that activation into those the glute muscles at the side, the gluteus medius, to help strengthen them as well. The pelvic tilt where you're standing, I'm not sure how well you'll actually see this one. I'll do it this way. So you're standing against the wall with your bum there. So you would tilt under to kind of press your lower back to the wall, and then reverse there. I'll just keep my hands out the way so you can see. So tilt under and then back. So you're just doing this standing against the wall, as opposed to lying down. You can also do it seated, but if you've got pelvic girdle pain or symphysis pubis disorder, sometimes doing it against the wall just makes it a wee bit more comfortable. Okay, your cat-cow position, where you're down on your hands and your knees, There, you're arching upwards to give you a really nice stretch all the way down the spine. As you come down, you don't want to be forcing the bump down and lifting your tailbone up. You just want to come back into a natural position there, and then exhale. As you come up, inhale. As you come down. So again, you're not going too far, you're just lifting the chin to look forwards. And then there, okay? The next one we will do, it's your wall downward dog. So your downward dog position in yoga would be here, yeah? But we are going to do hands lower than the shoulders and the feet coming out. And you can move hips from side to side as long as it feels comfortable enough to do so. Sorry, I've just realised you can't really see what I'm doing. Not that you want the best view of my buttocks there, but side to side, that's a wee bit better. So hands are on the wall and just moving side to side. That's your wall dog with your hip sway. Okay. If you feel more comfortable doing it down, you can take the hands on here and you're just releasing and side to side there, like so, and just letting the ball move as it does as you're going as well. Okay. So your hip swaying, child's pose, where you've got your knees together with your feet out nice and wide, taking the hands forwards and coming down. As bump starts to grow, you can take the hands onto the ball as you do that one there, or you can come into what we call puppy, where, whack myself with the ball there, where you would be in a child's pose but your bum would be up instead. Just giving you a wee bit more space for bump. Okay. So they are some moves that you can do to hopefully maybe alleviate a little bit of discomfort that you're having through the pelvis and the pubic symphysis area, and yeah, hopefully they might help. If you've got any questions about it, please don't hesitate to ask. If there's anything specific that you're doing and you're not sure if it's ideal or not, then just don't hesitate to drop me a wee message and ask, okay? Thank you for listening, and I'll speak to you soon. Bye-bye.